Let's talk about AV nodal block. What? AV nodal block or atrioventricular nodal block. Generally, it is called as heart block. It is the most common blockage that occurs in heart. What is it? It is AV nodal block. The blockage, as the name suggests, the blockage is occurring at AV node. Okay. It is divided into three types: first degree block, second degree block, third degree block. And also, second degree blocks is also divided into two types: type 1 and type 2. Okay. What is first degree block? First degree block is nothing but basically the peer interval increases in ECG, or you can say that the impulse that is getting generated from SA node is taking more time to travel through AV node than it should take. So the impulse that is getting generated in SA node is taking more time to go through AV node or travel through AV node. If we look at a general ECG graph, it looks like kind of this, not accurate, but this is P, it's Q, it's R, it's S, it's T. So it is the atrial depolarization. Okay. And after atrial depolarization, the impulse passes through AV node and goes to the ventricles, or yeah. So this in this phase is the phase of travel of the impulse. Now time for the traveling of the impulse getting impaired. So the PR interval, this PR interval, so this PR interval getting broader in first degree AV nodal block. Now let's talk about second degree AV nodal block, which is divided into type 1 and type 2. In type 1, the peer interval continuously get broader and broader at each beat, and after that there is a miss beat. What is a miss beat? There is a P wave in the beat, there is a T wave in the beat, but there is no ventricular contraction in between. Or maybe there is cannot be a T wave, but there it's sure that there is no ventricular contraction. So in type 1 of second degree AV nodal block, PR interval get broader and broader at each successive beat, and then there is a miss beat, and after that the beat become normal, and after successive beats it all again getting bigger. The PR interval again gets bigger and bigger. So this is the type 1 of second degree AV nodal block. Now let's talk about type 2 AV nodal block. In type 2, the PR interval is normal, but after some particular beats there is a misbeat. So in type 2 second degree AV nodal block, the irregularity is regular, Now let's talk about third degree. In case of third degree avinodal block, there no impulse no impulse can pass through AV node. So what's happened? SA node has generated its impulse. It has contracted the atrium, but it it fails to depolarize the ventricular muscles because it cannot pass through AV node. Then what happens? Purkinje fiber bundle of His and also the heart muscle present in ventricle, they can also generate impulse. But though they can generate impulse, their impulse generation capacity is less than that of SA node. Then the synchrony gets disturbed, the synchrony between the contraction of atrium and the contraction of ventricle. This 3-degree heart block is called complete heart block.